Quickly look at the pharmacology of another drug, also known as what? Mebendazole. And mebendazole is sold under various brand names, right? But one of the most popular brand names that this drug is sold under is known as what? The Vermox. All right. So looking at the pharmacology of this drug, we basically be focusing on the uses of these drugs. Which organisms does this drug actually has an effect against them? Then we'll also be looking at what? The pharmacokinetics of this drug, the clinical uses. Okay. So looking at this now, you see several pictures of what? Mebendazole. I see it has the name what? Vermox. All right. Mebendazole. This one is Vetnil. Okay, so it has different names. Okay, this one is Mebendazole 100. Okay, so it's sold under various brand names, but one of the most popular one is what? Vermox. All right, so this drug mebendazole is a synthetic form of what? Benzimidazole. All right, it has a wide spectrum use and is safe. Wide spectrum use in the sense that what? It has a effect on so many organisms. Okay, so if somebody is having an infection and you are suspecting that it's a worm, but you can't actually know the exact type of worm, you might just opt in for this drug before the laboratory result comes back with a specific cause. They start giving specific treatment. Okay, mechanism of action is what? Similar to albendazole. Efficacy is influenced by what? Gastrointestinal transit time, intensity of infection, and strain of parasite. Okay, it is used to kill parasites like what? Hookworm, Pinworm, Ascaris, and also kill Trichuris eggs. All right. Pharmacokinetics now. I think that's the effect of the drug on the body. All right. So less than about 10% of the oral administered drug is absorbed. Right. Absorption is increased with fatty meals. All right. Absorbed drug is what? 90% protein bound. Okay, I think this is a effect of the drug on the body, right? It is converted to inactive metabolites rapidly in the liver. It has a half-life of about 2 to 6 hours. It is primarily what? Excreted in bile. All right. So I think that's the pharmacokinetics now. Looking fully at the clinical use now. From the clinical use, you can get to see, you can get to just imagine the, what do they call it? Mode of action. Okay, it is taken orally before and after a meal. Tablets should be chewed before eating, before swallowing. Wow. Okay, so tablets should be chewed before swallowing. It has an effect on Ascaris, what? Lumbricoides, Trichuris, Trichura, Hookworm, and Trich strongylus. Okay, it is a useful drug in the case of mixed infections by this parasite. Okay, so if you're having a mixed infection by this parasite, it actually has a broad spectrum of action. In adults and children over 2 years, cure rate is about 90 to 100%, right? Except hookworm, but there's a marked reduction in the worm burden. Okay, so even if the drug does not 100% cure the infection, it will reduce the infection to a very barest minimum. Okay, so it also has effect on intestinal capillaries. Okay, capillaries. Okay, also has an effect on trichinosis. That has a limited efficacy against adult worm. Okay, then corticosteroids can be co-administered in severe infection. All right. Then the adverse effects and precautions now. There's no adverse effect in short-term therapy except for just mild gastrointestinal disturbances. All right. Now, with high dose, like if you give a very high dose, more than what is required, it could result into some hypersensitivity reaction, agranulocytosis, apolexia, and what? Elevation of liver enzymes. Okay. It is contraindicated in pregnancy. That means you shouldn't use it on pregnant women. Use with caution for people who are what? 2 years of age. okay, because it can result into convulsion. So you can combine this drug with what? Okay, carbamazine or phenytoin, okay, for uh, maximum effect. Okay, so that's it for the pharmacology of what? Mebendazole, sold under the brand name Vermox, with other brand names though. Vermox is the most popular.